Yeah.
Listen, busy day for you today. I'm happy that I was able to experience it again. And like I've seen you do it a number of times. I know you. I know what you do. But for those of us, or for those people who don't know what it is you do and where you come from and your background, can you kind of let them know that before we get into everything?
Honestly, I'm born and bred entrepreneur. My father was like I guess you call a loan shark back in the day. While he worked his company, he lended money. My grandfather, through marriage, was an owner of a tax and accounting firm with 2 businesses. My mother, her ex-husband used to be an entrepreneur that owned multiple, barbershops growing up. So when it comes, if I were to say the fabric of who I am, man, if you're talking about professionally, I'm an entrepreneur, through and through. And I like to find problems, solve problems, and after I solve it, I want to move on. Yeah.
A lot of what it is that I've witnessed you do in business comes a lot from the leadership and the training aspect.
Yeah.
So, and I've heard you talk about kind of your start in academia. So could you give us a little bit more about that?
Man, honestly, I ended up at Wiley University from chasing my basketball dreams. And through Wiley, they didn't have a lot of the degree plans going to an HBCU from a predominantly white institution. And so what fit was education. I either had to spend 2 more years in college or assimilate all of my credits to an education degree. And that's exactly what I did, but it was heaven sent, to be honest with you, because the people that I got to sit under, Dr. Mims and Dr. Ajanga, were the first people that actually told me that I could really be somebody outside of basketball. Other than that, everybody told me basketball was the way. But those were the 2 individuals that told me, hey, no, listen, this thing that you have something that could be impactful to the world. As a matter of fact, Dr. Ajanga was the first and only person that ever told me that I could be a doctor. So I didn't even know that was possible to become a doctor in anything outside of healthcare, being a physician. So it was a very cool thing. Of course, you see the doctors in universities, but you don't ever think it's really attainable for real. You just school, learning, trying to figure out exactly who you're going to be and what you're going to become. And that's how I kind of got into academia. I was at top in my class, graduated the Presidential Medal of Honor, 3.9 GPA when I graduated, #1 in the education department. So education is something that's important to me. I love words. I love the breaking down the etymology, the root words of things, and helping people kind of understand exactly where they are, especially when it comes to teaching and pouring into and training people. So people are the fabric of that. But if you don't know how to train, there's no way you can actually pour into them.
Good. Yeah. And I've been able to experience a lot of that throughout the years.
Yeah.
But now you got to start academia. When we talk about that, the academia start, how did you go from there, transition into a hands-on approach with Bizco Capital and being able to service entrepreneurs and business owners?
It was a lot of transitions of a lot of things. When I was teaching at Lancaster ISD and Dallas ISD, I realized that my impact was limited. Yes, impacting children's important, but if the parents are still in the same frame of thought, there's only so much you can do when the children are going back to the same environment. And then 2, I was the only one my age and being as young as I was in Lancaster and DISD, being an active teacher that was making 6 figures a year. So my goal was to become a superintendent, but I was $20,000 short from making the same thing my superintendent was making as a first-year teacher. So there were 2 things: impact, wanting to change people, and wanting a bigger name. I wanted a larger name. I wanted my name to be written in the stars. And then the second thing was I was nearly making what the superintendent was, which was considered to be the upper echelon of education. And that's when I realized that my talent and the cap of what I could potentially become, who I could become, was limited. And I wanted something different. So through that transition, that's how I got into finance, insurance, and retirement. Got into that world. I was recruited by one of my very best, most important, most pivotal mentors, Tony Stevens Sr., who poured into me a lot. He taught me how I can intertwine what I believe in with my business. He taught me how to recruit. He taught me how to talk to people. He taught me how to sell. He taught me all of the things that you need to be a successful entrepreneur and a go-getter. That's what he taught me. And through the transitions of finance, and we end up buying companies and growing and getting the education division, getting the tech division, and increasing our reach in insurance. Before you knew it, it did become BizCo Capital, a company that's an acquisitions company that typically goes in, fixes companies, buys companies, and sells them. So it ended up becoming something of that. And here's a small story that most people don't know. I found out what a business consultant was my second or third year out of college. And I actually applied like 100 times to consulting gigs, but I didn't have the finance background, the business background. They didn't even look at my application. And so my way to the world that I'm in now, corporate transformation, corporate turnaround, is a back door into business consulting, because nobody ever gave me a call back to actually get into business consulting once I really figured out what it was.
BizCo Capital has been kind of your baby for
It's been my baby forever, yeah.
Talk about some of the successes of BizCo Capital over
Sure.
the years.
Let's just talk about what BizCo means. BizCo means business ecosystem. So when I'm looking at a company, I'm truly looking at it from a doctor's view. Like, how can I fix this baby or this business so that its entire ecosystem can be capital friendly? It can grow capital, raise capital, build capital, and sell for more capital. And to be honest with you, we've had a lot of successes. We've had a history of building a reputation of within 6 months of us working with companies, they saw more than 60% increase in productivity and profitability. We work with companies as big as Amazon, Capital One, Coca-Cola, Shea Moisture, you can name it, we've worked with them. We've been able to transfer and teach more than 15,000 business owners in over 22 countries. There's so much that we've done in BizCo Capital as BizCo that I'm most proud of. We've been in Entrepreneur Magazine, Forbes Business Council, Yahoo Finance, Yahoo nominated for being one of the most fastest growing and most impactful financial firms in business education companies in the world. And yeah.
Listen.
All before 30.
All before 30. That's a lot. Those are feats that most don't even see as attainable. And again, like you said, you did it before 30.
Yeah.
Now, with BizCo and BizCo Capital, BizCo Systems, you've been able to help guide businesses globally.
Yeah.
And you've reached a lot of success on your own in the business consulting space as a business owner, entrepreneur, a business developer, now in the space of a business turnaround specialist.
Yeah.
Right? What was it after all that success and what it is you're doing in business development? What caused you to take a look at the healthcare?
Actually, we were in a company meeting at BizCo, and my executive team, we were talking about the things that we needed to do to grow BizCo, and I felt like we've done as much as we could do for the small and mid-sized businesses. We've traveled, we've won awards, we've got to participate in some of the best and finest of life, but I was really looking for more impact. I wanted, again, I'm gonna keep saying this, I wanted to be considered, and I want to be considered one of the best business turnaround specialists of our generation, and hopefully maybe in the world. And in order to do that, I needed to be a part of an industry that needed a lot of changing, needed a lot of pushing, needed innovation, that had a lot of talent that wasn't being spoken of much, and that truly touched and impacted most of our lives. Because a lot of our service offerings were limited in its approach. It serviced people for periods of time in their life. And not everyone is an entrepreneur, not everyone is a business owner, but in the healthcare space, whether you're an entrepreneur, a business owner, a C-suite, you're a president, you're a prime minister, it doesn't matter. Healthcare touches every single person on this planet, whether you want it to or not. When I thought about an international reach, I was like, man, I want to be a part of an industry that can truly change lives, save lives, and be impactful. Not superficial, not things that are just in books. But I know that my system, my structure, me reorganizing something truly impacted a person's ability to live, thrive, and be successful. which is why I loved coming into the healthcare space, and I loved being able to partner with hospitals to turn them around, to help them be better, more efficient, more effective, to ensure that patients' lives are better than what they came in with.
This is factual. Healthcare is a part of everybody's life in some aspect.
Yeah.
But the approach or the door that you wanted to walk through when it came to healthcare was specifically in central sterilized processing.
Yeah.
What is that, and why you choose to walk through that door? Healthcare is big, and we talked about you not even believing that a doctor was even possible without being a physician.
Yeah.
Now you are Dr. Jake in
Business
the space
doctor,
of healthcare.
Yeah.
Working with doctors, something that you didn't see, but then going into a sub niche inside the healthcare industry of sterile processing that most people have never heard of.
Yeah.
You got to tell me about
So
that.
it started with being sought out by SIPS, by Donnie Payne and Karen Cherry. We're currently at SIPS the #2 largest management and advisory firm in central sterile processing in the country, regardless of color. And they came to me wanting to break through the ceiling. We want to become #1, and we want to become top 5, top 10, and even #1 in healthcare as far as bringing the solutions that we offer. And when they came to me, I was like, I don't know. So let me find out more about it. Let me figure out the team. Let me see what's kind of going on. And they start off as a client, to be honest. But I fell in love with the industry. I fell in love with the staff. I fell in love with the team, that I wanted to be a part of what SIPS actually was. And when we talk about central sterile processing, most people don't know central sterile processing is the heart of any healthcare system. Without central sterile processing systems in a processing department, you're talking about there's a ton of people that will get surgery and be infected, that will lose their life, that will lose limbs because the instruments that the doctors use aren't clean, aren't fixed, are rugged or whatever. So I like to liken what we do to almost being like T'Challa's sister in Black Panther, the one who created the armor that allowed for the superheroes to go be great. What is a superhero without their tools? What is a superhero without their uniform? What is a superhero without their powers? And so when we talk about doctors and their ability to go, and surgeons, their ability to go and perform surgery, you can't perform surgery without the instruments. You can't cut somebody's skin with your fingers. You need central sterile processing that provides the instruments, that sterilizes the equipment, that makes sure that things are repaired, so that when you are about to perform surgery, you have all the tools that you need to not only save a life, rehabilitate it, and make it better than what you found. So, yeah.
Great.
And I love a good underdog story.
That's exactly what I'm going with, because being an underdog is kind of where a turnaround specialist really fits into the picture at.
Yeah.
So as a turnaround specialist and coming to SIPS, what unique skill sets do you feel like you offer that you bring to SIPS? And with you bringing that to SIPS, what's the trajectory that you see SIPS on? What's the vision where you guys
innovation? Eyes that are not subjugated to what the norms are of this industry. If the norms of this industry could make this industry better, it would have already been done. So you need new eyes, fresh eyes to be able to do it. Secondly, as a business turnaround specialist, you have to be operations and financially focused to be able to ensure that you're making these hospitals more efficient, more productive, and more valuable, which is why I'm so big on people. Because everyone invests in technology, they invest in equipment, but don't invest into the people that need to use the technology and the equipment. It's like backwards, it's asinine. And when it comes to this space, especially being this space, in what we do well, I believe that the biggest thing that I bring to this industry and what I bring to SIPS in our pursuit to becoming the #1 advisory and management firm that turns around hospitals for central sterile processing is the fact that no is not an answer when a patient's life is on the line. That's what I think about. When I think about our moms and our sisters and our brothers that's been through so many surgeries and how one instrument could have cost them their life. Somebody getting shot in the chest or somebody getting mutilated and they're on their last breath and a surgeon has to come in last minute. If that equipment isn't there for that surgeon to be able to perform surgery, that person could die right there. That's when I think about impact. Forget trying to help people make all this money in the world when people are dying from healthcare and epidemic and there's a shortage there. So when I see opportunities, I see trends, that's what I see. Matter of fact, see how I'm sitting in this chair. I don't even sit in chairs normally the right way. Why? Because innovation and change has no rules and has no bounds. As long as integrity is there, as long as I'm focusing on never harming anybody, doing right by what I said that I can do, I believe that SIPS is in a prime position to not only take number one, but completely change the trajectory of how people see central sterile processing, because I will not be finished until people go into the hospital that's about to have a surgery are asking central sterile processing questions. Who's doing the equipment? Who's doing the instruments? How many times is it cleaned? How have you checked it? Let me see the rating. When's the last time that JC, Joint Commission, has come? When's the last time that you guys have been flagged? When's the last time that the surgeons had to push cases back because the instruments are not clean? We always check the doctor and the surgeon's credibility, but we never check the central sterile processing department credibility on ensuring that the instruments that are being used, that are being cut to cut me open in my body, are properly sterilized, repaired, and perfect to enter my body, which can affect my entire life.
Listen, what it sounds like to me is that SIPS is a sterile processing and healthcare titan. And from what I know and the experience with you, I look at you the same way, and many people look at you the same way in the business world.
Yeah.
So it's like you said, SIPS was a client at first. And they came as like two titans coming together, business, healthcare, sterile processing coming together. And now they're no longer just a client. Now you're actually in the role of COO
and partner
at SIPS, right? So based on everything that you've done before, prior to becoming here and sitting in your current seat at SIPS, having your current role and your current responsibilities, what prepared you in the past, with your past experience leading a company, consulting, your academia, sports, prepared you to be able to sit in the seat to take SIPS where you see it going and where it needs to be?
We built an 8-figure conglomerate with $0, no money, no car, from an idea, a piece of paper, and a hope and a dream that ended up becoming a company that touched lives in over 22 countries. So when it comes to being cost efficient, being innovative, thinking outside the box, like those are all things that we needed to be able to even survive. And the most beautiful thing about this company is that not only is it woman owned, it's BIPOC women owned, Black, Indigenous, people of color that happen to be women, that are inclusive of all people. So I love the fact that me as a man, that I can come and support the vision of two women that started this company, that began to be something from an idea, that became the second largest. They hit a cap. And who am I to talk about unity and bringing all of our top talents to be able to push through barriers if I'm not the first to be able to sit and do it? See, I'm a firm believer that if you want to be part of history, you have to team up with people that are willing to make history. You can't make history alone. And to be honest with you, I just want to make an impact that not only will put us on the map as far as history being made, I want to make such an impact that hospitals forever are changed all over the world, so that people can know that when I get a surgery, I can rest assured that everybody dotted their I's and crossed their T's. And I'm going to come out of here not only better, but healthy, well, and okay with myself. Because we give all of our trust into these hospitals to save us when we're in desperate need, not even knowing all of the risks we take the moment that they decide to help us. That's the key that I want to solve.
Business is something that you absolutely know in and out. Healthcare is something a little bit newer to you as far as an industry, specifically sterile processing.
Yeah.
And me learning about sterile processing during this process, I know you've been learning about sterile processing more and more through this process, a lot more hands-on. If you could name a couple of misconceptions that people have about sterile processing industries, about the sterile processing industry, those that are aware of it, what would you say some of those are? Even if there were some of your own that you've debunked, what would you say some of those are?
I didn't really even have anything to debunk because I never even knew sterile processing existed. There's two things that I do want to debunk that's typically being said. A lot of people in sterile processing are called the people downstairs or the stupid people downstairs. But the people that I've met in sterile processing, some of them are the most brilliant people I've ever met. Because in the hospital system, when you think about the history of sterile processing, they were recruiting people that were cleaning dishes to come clean the equipment and the instruments that surgeons were using to perform surgery on us. So the quality of people, they consider us to only be people that are not as intelligent or not as smart or not as capable or not as willing or not as able to handle complex issues. But when we think about sterile processing, you can't name me one leader that can handle robotics, innovation, automation, technology, people, communicating with doctors, executive teams, lawyers, joint commission, all of these other entities that it takes to run a central sterile processing department. You can't name me one thing about what we do in our industry that is simple for people to say that those are those people downstairs. So my biggest thing is to bring about respect to this industry that we service. Yes, we're not the doctors. Nope, we're not the emergency nurses where everybody can see them, Batman and Robin. But can I tell you something? Can I tell you something really clear? Who are Batman and Robin without the people making their uniforms and their tools to be able to go out there and be Batman and Robin? At the end of the day, we give them the weapons that they need to save lives. We give them their cape that they're able to fly on. Without central sterile processing and the equipment and the instruments that we sterilize and process every day, infection rates, death will be rampant. What we do not only matters, we're the heart that people don't pay attention to. Yeah, you can see your body. I can see your clothes, I can see your skin, I can see your eyes, I can see your lips, I can see your ears, I can see that. But the one thing that's the biggest muscle in that body, that once that thing stops beating, everything dies, is your heart. And central sterile processing is the heart of every hospital system. And until every hospital system starts to see that, we're gonna be here beating our drums, talking as loud as we can, innovating as much as we can. Because they can't say doctors aren't here, we are. They can't say extremely intelligent people that haven't done amazing things aren't here, we're here. So now what is your excuse not to give us the respect that we need so that we can't go and recruit the top talent that we want to recruit, so that we can ensure that this greatest secret in healthcare is through central sterile processing that controls all of the functions and communicates with all of the functions within the hospital. Come on. You can have the best surgeons in the world, but if the central sterile processing department is not that good, the best surgeons in the world will never come and perform surgery at your hospital.
Listen, that's a lot of big boy talk.
Yeah.
That's a lot of things that sound really, really good, but I got to give you some pushback. I got to challenge a little bit. Based on all the stuff that it is that you've done in business over the years, based on you coming to SIPS and the vision that you saw at SIPS, what is SIPS doing? What initiatives do they have to actually build better and make better in healthcare and allow more people to come into the space? What is SIPS actually doing?
I'm glad that you asked. The biggest conversation is not enough creative, innovative, intelligent people coming into healthcare, specifically central sterile processing, as we see shortages all over healthcare. So what SIPS was doing, we put our own money where our mouth is. We put together an $8.25 million education fund of our own resources in dollars. We're going to be bringing 1,000 people in the healthcare space through. Not only bringing them through, it costs $8,250 per person to not only get them certified, to get them through all their education barriers, to when they finish our fellowship from our education fund, they'll finish with a master's degree in leadership and management in healthcare. So what we're doing is we're putting our money where our mouth is. We're not the biggest in the world, but when it comes to actually investing in the people and starting that momentum and pioneering the same way that we've been doing since 2005, we absolutely are putting our money where our mouth is. So $8.25 million fund is earmarked. education fund specifically for introducing people that know nothing about healthcare into our world, getting them certified, getting them direct with our direct partners in hospitals that we work with, Methodist, BSW, Medical City, specifically in Texas, Mount Sinai, that's in Chicago. We got all these other places that we work with all across the country, hospitals that we have partnerships with, that not only are we going to give them the education that they need to get into healthcare, we're also going to get them the clinical hours through our hospital partnerships and get them placed on jobs. So not only are we educating, not only are we giving them exposure, not only are we providing educational advancements so where we take care of their master's degree, we also are getting them placed so they can actually start their career and get into the medical industry. So not only are we putting our money where our mouth is, we're putting our time, our energy, our effort, and our resources where our mouth is to ensure that we can be the change that the healthcare system needs.
Listen, that $8.25 million
Correct.
being set aside in the education fund. So they're going to be able to get certified, trained, their clinical hours, and even be in position to get staffed at a partnering hospital or a healthcare facility to be able to carry out and get paid.
We built our own degree plan with Harvard Christian University. We're the first consulting and advisory firm to build a degree plan, a master's degree plan, specifically targeting specialty in central sterile processing that's ever been done before in American history.
So you're talking about innovation and it sounds like two different industries, both education and healthcare simultaneously. Well, you said the reason that you came here was for innovation. Now, throughout your career, a big focus has been in leadership.
Yeah.
How do you see the leadership in the sterile processing industry, and is there any room for you to provide expertise and experience and training there?
Yeah, so when we've seen, since I've been in the industry, we've interviewed more than 150 leaders all across the country. And then we've interviewed directors that are supposed to have their own budget, that's supposed to be leading their own departments of central sterile processing, that don't even have writing ability or the ability to sign. We call it signing ability. Signing ability says when I see a change in my department, I can sign and the hospital trusts me with my budget. The reason why is because there's a lot of people in central sterile processing that have been given director roles but have not been given director access. A director role says, here are all the responsibilities. Director access says, here's the responsibility and the ability to create change. You know the biggest reason? Because more than 60% of people that are in director and up roles have master's degrees. What we realize is that you see people that got into central sterile processing as a trade, spent 20, 30 years that worked their way through a department, worked their way up to director role, but they won't be given director access because they don't have certain certifications and certain things. So what we said within our education fund is said, no. When the people finish our 3-year fellowship working with SIPS, not only would they have the access, not only would they have gotten the environment, exposure to a good environment, not only would they been trained leadership and management in healthcare, they'll finish with their master's degree. So that would no longer be an issue when it comes to promoting up within central sterile processing. We deserve to have our leaders to have a seat at the table that understand central sterile processing, because the problem that's being had is that there's a lot of management that happens in the department that most managers would never set foot in. Do you know how many people in central sterile processing that are in charge of the budget and the signing ability of central sterile processing and then have never even set foot at being in a facility in central sterile processing? Imagine getting access to keys to a city, a state, or a home that you don't even know what it looks like. Never even been to it. Don't even know how it functions, but now you can set all rules to how things need to be. This is what we deal with especially when it comes to a department that is so needed in every hospital. So our goal is not to complain about it. I understand their plight, because there are a bunch of leadership that know what to do in sterile processing, but don't know how to run a healthcare department, to manage budget, to lead and develop. So versus making all those excuses, versus doing all that other stuff, again, we have an $8.25 million fund. We're putting our money, our resource, and our time where our mouth is. We're going to take people that have never been in healthcare, that can think innovatively, that haven't been judged or haven't been put down or don't have any of the preconceived notions that come with what experiences of this space. We're going to train them from scratch and get them not only into leadership to be able to invoke change the way that they need to. And we have people that went through our program already, within 2 or 3 years are running full departments, never being in healthcare before, making good money, having the ability to sign and influence change. And we know that it works because we've been doing it.
Good. Let's shift gears just a little bit and focus on that leadership aspect.
Okay.
Post-pandemic now.
Yeah.
Pandemic came, went, a lot of stuff changed, including the leadership styles, or the leadership required post-pandemic. So let's talk about your leadership approach, how it's evolved post-pandemic, and what are you doing to apply these changes that you're experiencing as leadership to SIPS and to the healthcare industry as a whole?
Here's my position, here's my tenure, and a lot of people have been promoted what I call battlefield promotion. Because you've been around, because you're easy to deal with, because everyone likes you, because you have 30 years. It doesn't matter if you have leadership ability, it just matters that you know this system, so therefore you're a director now. No. This new post-pandemic, the fact that the pandemic happened, for the first time in American history, everyone was forced online. When everyone was forced online, you know what also they saw? Other opportunities that they could be able to indulge in that they never had time to see prior to the pandemic. So when people know that they have options, do you think they're going to deal with being treated in any kind of way and not paid what they're supposed to be paid? No, absolutely not. So the totalitarian leadership, top down, military style, do as I say, not as I do, because of my position, because of my rank, that is done. People post-pandemic are coming back and saying, you're going to talk to me and treat me like a human being, as a man, as a woman, as a mother, as a parent, as a father, as a grandparent. You're going to treat me with respect, not because you have to, but because that's your duty as a human being. So if you don't have to, but your duty should be to treat me with respect and to coach and to train me in the capacity with love and compassion that you should treat me in. And so in this space, leadership has changed. People aren't scared to leave jobs anymore. People aren't scared to venture out anymore. People aren't scared to go do Uber, to go do DoorDash, to go get on social media and TikTok dance all day. People aren't scared to go to affiliate marketing or network marketing or find other means to make the $3,000, $4,000 a month. At least they have their dignity and respect. So when we talk about leadership that has evolved past post-pandemic, respect is setting the table. In order to get respect, I must see that you're first willing to lay down respect. And from there, when I see that you have my best interest at heart, I'll deal with your criticism. I'll deal with your chastisement. I'll deal with your hard coaching. But I got to understand why now, especially being the fact that now we have some restaurants paying managers of a fast food joint $30, $40 an hour. When I can go get paid $30, $40 an hour and be respected at something like In-N-Out or Buc-ee's, the restaurant, why would I ever want to be in any environment that pays me less, that treats me like crap?
This totalitarian style of leadership, of how things were, seems like a very black and white. I'm the leader, you're not.
Yeah.
I know, you don't. I've been here, you haven't.
Yeah.
But now I hear you teach and train from a leadership in the gray type of world.
Yeah.
Talk about kind of what that phrase means and what that style
Great,
of
because
is.
leadership back then used to be black and white. Here's the policies, here's the rules, this is the thing. 10 years here, then you get promoted, then you get accepted. No, leadership in the gray says, hey, all of that is muddy now. We don't know what the future is for any industry because of the advancement of technology is going faster than ever. Every 6 months, it seems like something new is happening. So leadership in the gray is absolutely that. It's how do I lead in ambiguity? How do I lead without being sure? How do I lead not knowing exactly where people are and not knowing all the options that you have? Because back then, when you used to get your job, you was within that same community. Most people didn't even travel like that. You went to the job board, whatever that was around you, you stayed to your pocket. Social media didn't expose you to anything a lot like that. So when I know that leadership isn't the gray, I know your exposure. I know what you're seeing every day. Get rich schemes every day. Get rich schemes every day. Learning, you got education and real estate and buying and all of that. I have to lead in the gray. It's no longer black and white. It's everything but black and white. How do I take somebody who grew up only with social media and let them know that having a career is just as valuable as trying to be an entrepreneur where nobody makes $1 million? How do I teach somebody that? How do I show somebody that knows somebody that's on TikTok and YouTube making $4,000 to $5,000 a month making videos? How can I show them that it's just as important so you can make $4,000 to $5,000 a month in healthcare? Do you think if I talk to you crazy? There's a bunch of people doing a bunch of stuff that can't read, can't write, can't do all this stuff, but they're figuring out a way to be productive and valuable. My job in leadership in the gray is to figure out what makes you tick and speak to your heart right there, which means that we have to have more empathy. We have to be people-centered. We have to focus on building a people-centric environment and organization so that the people can feel like I'm wanted here. That makes people want to stay, to provide their support, to give, to develop more when I see that it's possible and you respect the possibilities that I have and the potential that I have.
Transitioning, man, to the healthcare space is something that most don't see possible. Most can't find a pathway through.
Yeah.
And better yet, a pathway where they can be a leader on that pathway. For SIPS, guiding them down there to become the major type. Said the number 2 right now. I'm only knowing that
number 2 privately owned. Yep.
Going for number 1. So what are some long-term goals that you have for SIPS now that you've come here, gone through the client phase, now in the seat of the COO and in charge of helping take this company to the next level as the turnaround specialist? What are some of the long-term goals, visions that you have for SIPS and want SIPS to achieve? We
want to be the number 1 healthcare solutions provider in the country. That's privately owned. Staffing, consulting, advising, we want to be considered first, regardless of color, creed, sex, belief, religion. That's the goal. That's why we hire diverse. When you look at our organization, it's every color, every credence, every belief within our organization. Yes, there's an obvious, we're black owned, but we're not black only. We want to impact and impart everything that we can into this healthcare space because more than 86% of the central sterile processing departments are black owned. Are black ran, black and brown ran, BIPOC brand, BIPOC, black indigenous people of color who actually do the work in central sterile processing. But more than 86% of the leaders are not of that same descent. So when diversity is there, diversity in leadership is also needed. Whoever's the best, I don't care. Whoever's the best, not who is most tolerable to you.
So it's a lot that you've done, a lot of accolades, a lot that SIPS has done. Yeah. And now that you guys are here together, it's a lot that you plan on doing. But for the regular person that may hear this or may see sterile processing and have an interest to move forward and have an interest to become a part of the industry and maybe even a rise to leadership inside the industry, what would you tell them to do to get started, to get assistance from SIPS to go down that pathway?
Go to sipshealthcare.com/fellowship. You'll be able to find out a lot there. What I would suggest for people to do, if you don't know an industry, be guided to know it. Because you got to be careful the source of the information that you're getting when you're learning about an industry, because you can learn about any industry and be turned off. So allow us to guide you through if you're interested, and for those that are interested to apply for getting accepted into our fellowship, our 3-year fellowship, where we cover your cost of your education, including your master's for healthcare leadership and management, where we cover that cost and we get you placed, we get you your clinical hours, to go to sipshealthcare.com/fellowship so that you can apply, put your names on that waiting list so that somebody can reach out to you and tell you the process that it takes for you to actually get started within what we're doing. Because our number 1 goal, again, I don't care who you are. I don't care what you look like. I want talent, top talent, people that want to be innovative, people that want to change a lot of things in this industry. Because whether you want to believe it or not, our families' lives depend on it. When you have a shortage in the hospital system, it's a scary thing. Imagine seeing doctors and nurses and people in central sterile processing working 60, 70 hours a week. And then at their fatigue, their breaking point, now they're working on your mother, your daughter, your father, your son, your sister, your brother, your grandma, your grandfather, and that last hour. That's a scary thing to think about. And when I think about that, it makes me want to dig deep to work with anyone that we can to ensure that we can take and transform lives forever.
Good. Again, I appreciate you, Dr. Jake. And again, know you got a busy day even ahead of you. But one more time, let them know who you are, where they can find you, and then also leave them with something to sit on their shanana.
My name is Dr. Jake Tayler Jacobs. I'm the COO of SIPS Healthcare Solutions. You can find me on Instagram at SIPS Healthcare or Jake Tayler Jacobs on Instagram. One thing I want to leave you is, when you think about your life, ask yourself, am I aligning my life to truly be impactful? Or am I aligning my life just to make income, to just change my life and impact my life? When you think about living life full is asking yourself, is what I'm doing truly impacting other people? Or am I living life selfishly, where you only want to impact yourself? And I can promise you one thing, you may become the wealthiest person in the world, but you will be the loneliest person in the world. And what good is wealth when nobody wants to share it with you?